This time last year, the US was recording 1,000 COVID deaths each day, and it had the highest number of cases in the world.
Tonight, the United States has reached yet another devastating and unthinkable moment in a pandemic that continues to change our country and our way of life.
A year on, 70% of adults have received at least one dose of COVID vaccine, and the death toll has plummeted. But the highly infectious Delta variant has been blamed for a new surge in cases, around 80,000 a day, mainly among unvaccinated Americans.
This is becoming a pandemic of the unvaccinated.
A third of all recent cases this past week have been found in Florida and Texas, where only half the population is vaccinated. Unlike Australia, vaccine supply is no issue, and health officials are pleading with unvaccinated Americans to get their shot. One of these experts is Dr Anthony Fauci, who's the director of the US National Institute of Allergy and Infectious Diseases. Dr Fauci, the last time you spoke to our program was in November last year. The COVID numbers in the US were devastating, Donald Trump was still in the White House, and the rollout of the Pfizer vaccine was a few weeks from starting. It's been a big turnaround. The US has got a much larger proportion of the population vaccinated than Australia. What's been the key to that success?
Well, the key has been really the effort that has been put in by the Biden administration to implement the vaccine distribution program with a lot of outreach. And that was outreach in the community, getting the vaccines available in large vaccine hubs, such as athletic facilities, stadiums, parking lots, things like that. And then from there, you went out into the community. When you got that low-hanging fruit done, you went down by getting pharmacies. We have 40,000 pharmacies that we've put vaccines into, where people don't have to negotiate a computer, can just walk in and get a dose. We have mobile units that go out. We have a big equity program to try and access our brown and black people who are generally more vulnerable to getting the severe effects leading to hospitalizations. The problem is now that we've gotten that core group of about 93 million people who are still eligible, that's a group that's been somewhat resistant. So we've got to do a bunch of things. We've got to continue to outreach. We've got to get trusted messengers out there, clergy, family physicians, trusted members and admired members, sports figures. We're doing the young, because we only have about 40% of the young eligible vaccinated. So we're doing things like getting rap groups and Instagram groups and people like that that interact with the younger people. So we're really putting in a really, as we say in the basketball analogy, a full court press to get this done. The only difficulty that we're seeing is that there is a political divide here, where when you look at the countries that are fundamentally red states or Republican dominance, we're having a disproportion of that. About 40% of all the new infections in the United States are occurring in two states, Florida and Texas. 20+% of all of the infections are occurring in Florida. And that's really because there's that feeling they don't want to be told what to do. They don't trust the vaccine. They're not getting the right kind of a stimulus to do everything you possibly can. So when you get a virus like the Delta virus vaccine, the Delta variant is so easily transmissible that when you have 93 million people vulnerable in your country, you're going to see the numbers go up. And that's unfortunately what we're dealing with right now.
So you've talked a bit about the vaccine hesitancy problem and then also the political divide on the vaccines. What are your public health policy options in such a situation?
It is, but we have what I think is going to be a solution coming soon. There is a reluctance, Laura, to do mandating of vaccines from the federal level, at the level of the president. He can do it in federal facilities. However, one of the things that's holding people back for one reason or other is waiting to get the vaccine fully approved and fully licensed because it's still on an emergency use authorization. Authorities at the local level are hesitant to mandate vaccines because of the afraid of the legal implications that if they don't have a licensed vaccine, someone can sue you for trying to force you, as it were. However, once you get a vaccine fully approved, you are going to get universities and colleges which will say, if you want to be in our institution, you've got to get vaccinated. That will encompass a substantial proportion of the young people. You will get major industries. I don't know what they will be. You know, oil companies, Amazon, Microsoft, whatever it's going to be. I don't know if I'm just naming them empirically, who are going to say, if you want to work in our place, you are going to have to get vaccinated. I think that's going to go a long way of getting for those people who still don't want to get vaccinated.
What's your view on immunising children?
We feel, our decision, Laura, I know it's controversial. We feel you really need to get the children vaccinated. They will get infected. They will spread it inadvertently and innocently because most of them would likely not get severely ill. They could be asymptomatic spreaders. So we've got to get the kids vaccinated because this is a very, very transmissible virus.
And just on the origins of the virus in Wuhan, what do you make of the investigations? And have you got an open mind about the origins of the virus?
I do. I have an open mind, but, speaking to a large number of experienced evolutionary virologists, including your own Eddie Holmes, who's quite good, feel rather strongly that although we all keep an open mind, that the most likely scenario is that this was a natural evolution from an animal model, an animal host, into the human host. Having said that, we still keep an open mind, and we're very much in favor of this, looking into every possibility.
Dr Anthony Fauci, thank you so much for talking to us tonight.
Thank you very much, Laura. It's always a pleasure to be with you. Thank you for having me.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.